Welcome to our deep dive today, all about data standards, especially in healthcare.
Yeah, it's really going to be a behind-the-scenes look, I think, at how technology is making healthcare smoother and more efficient.
Exactly. And think about this for a second. We have different hospitals, we have different doctors' offices,
Yeah.
and they all use, all these computer systems, right?
Right.
And if those systems can't talk to each other,
Yeah.
it's a real headache.
It is. It's like trying to have a conversation with someone who speaks a different language. And that's where these data standards, often shortened to DS, come in. They act as that common language for all these different systems.
So DS are the key to making sure that the information can flow freely between all these different parts of the healthcare system. That's a pretty big deal.
Huge, huge deal. And to understand how it works, let's look at this idea of levels of interoperability. This is basically just a way of describing how well different systems can exchange information and actually use it.
Levels of interoperability.
Yeah.
That's pretty technical.
It does sound technical, but imagine it like a staircase with 4 steps.
Okay.
So the first step, the most basic level, is called foundational. And at this level, systems can at least connect to each other. It's like having a working phone line, right?
Okay, so we have a connection. What's next? What happens next?
Then you go to step 2, which is structural. And now we're talking about making sure that the data is formatted in a way that both systems can understand. It's kind of like making sure you're using the right grammar when you're speaking.
So it's not enough to just connect. You have to have the data presented in a way that makes sense on both sides.
Right.
So what's the next step up on this staircase?
You go to step 3, and this is where it gets really interesting, I think. This is called semantic. And now we're ensuring that the actual meaning of the data is clear and consistent. So for instance, we want to make sure that heart attack means the same thing in every system, regardless of whether it's, written out or coded in some way.
All right, so we're moving beyond just the structure of the data, and we're getting to the actual meaning.
Yeah.
Which is, obviously crucial in healthcare.
Yeah.
So what's the final step toward full interoperability?
The final step is organizational. Step number 4. This is like the holy grail of interoperability, where you have smooth, secure data exchange happening between entire organizations. Imagine a world where your medical records could seamlessly follow you no matter where you received care.
That would be incredible. So these 4 levels, foundational, structural, semantic, and organizational,
Yeah. really
really kind of outline the journey towards truly connected healthcare systems. But how do data standards actually fit into all of this?
Well, they're the building blocks of interoperability. They provide these specific guidelines for achieving each of these levels. They go beyond these abstract ideas and get into the nitty-gritty of how data should be handled.
So they're like the instructions, the detailed instructions that tell systems how to exchange this information correctly at each level.
Exactly. Let's look at some of the key things that data standards define. First, they define the structure of the data, right? They act like a blueprint for organizing and categorizing information. Think of it as the framework that holds everything together.
Okay, so structure is the foundation. What else did they define?
Next, they specify the data types. They make sure that the systems know what kind of information they're dealing with, numbers, dates, text, and so on. This ensures that the data is stored and processed correctly.
Right, they lay out the rules for how all the different types of data should be handled.
Right.
What else?
Perhaps most importantly, they define vocabulary, making sure everyone's using the same terms for the same concepts. Like, for example, is it high blood pressure or is it hypertension?
Yeah.
Right? Having a standardized vocabulary avoids confusion and misinterpretations, which can be, very critical in healthcare.
Sounds like data standards are the glue that holds everything together.
Yeah.
Making sure that data can be shared accurately and meaningfully, making sure everyone's speaking the same language.
Yeah.
Which is a huge step towards better healthcare.
It is. You got it. But achieving this level of data consistency, it's not always easy.
I can imagine.
Yeah.
So where do we go from here? How do we actually make sure that the data being used in healthcare is accurate and reliable?
Well, that's a great question, and it brings us to this concept of data labeling, specifically the difference between gold and silver labels.
I've heard those terms thrown around before, but I'm not entirely sure what they mean.
Well, imagine you have this massive amount of data, like, medical images or patient records, that needs to be analyzed. To make sense of it, we often need to label it. Basically, we're just tagging it with specific information that tells us what it represents.
So it's like adding keywords or tags to a photo.
Exactly.
So you can easily find it later.
Exactly. Now, when it comes to data labeling, we have 2 main approaches. gold labels and silver labels.
Okay, I'm intrigued. What's the difference?
Okay, so gold labels represent the highest level of accuracy. They're created by humans who carefully review and label each piece of data, ensuring that it's tagged correctly. This is often a very time-consuming and expensive process, but it results in highly reliable data.
So gold labels are like the gold standard for data accuracy because they involve human expertise
Exactly.
and meticulous review.
Precisely. They're the preferred choice for tasks where accuracy is paramount, like training AI models for medical diagnosis or conducting sensitive research.
Right, that makes sense. So what about silver labels then?
So silver labels are created using algorithms and machine learning techniques.
Okay.
This makes the process much faster and cheaper than manual labeling, but it can come at the cost of accuracy.
I see. So it's a trade-off
Yeah.
between speed and accuracy.
Exactly. While algorithms can be incredibly powerful, they can sometimes miss subtle details or make mistakes that a human would easily catch.
So silver labels are more efficient, but they might not be as reliable as the gold labels.
That's right. And the choice of which type of label to use really depends on the specific application and the level of accuracy that's required.
Okay, so we've covered a lot of ground already. We've explored the importance of data standards, the concept of levels of interoperability, and the distinction between gold and silver labels. It's clear that a lot of thought and effort goes into ensuring that the data used in healthcare is accurate and reliable.
You're absolutely right. And this is just the tip of the iceberg. There's so much more to discover about the world of data standards and how they're shaping the future of healthcare. It's fascinating to think about how all this data is actually put to use. It's not just about collecting the information. It's about making sure that it can be understood and used effectively. And that often involves some pretty complex processes kind of behind the scenes.
Now you've got me curious. What kind of behind the scenes work are we talking about?
Well, one of the key challenges in dealing with healthcare data is that it often comes from a wide variety of sources.
Right.
Different hospitals, clinics, labs, they might all have their own ways of recording information.
Right. It's like trying to put together a puzzle where all the pieces are for different sets.
Exactly. And that's where these concepts of normalization and harmonization come in.
Okay, those sound like some pretty serious data wrangling terms.
They do.
Can you break them down for us?
Absolutely. So let's start with normalization. Imagine you have data from 3 different hospitals, and they all have a field for patient's state of residence.
Okay, seems straightforward enough. What could be so complicated about that?
Well, one hospital might use the full state name, like California. Another might use the 2-letter abbreviation, CA, and another might use a numerical code.
So it's like they're all speaking different dialects of data.
Exactly. Normalization is the process of making sure all that data is formatted consistently. So you might convert everything to the 2-letter state abbreviation, for example.
So it's like cleaning up a messy spreadsheet.
Yeah.
Making sure all the data is in the same format.
That's a great analogy. Now, harmonization goes a step further. It's not just about consistent formatting. It's about making sure the meaning is aligned, even if the format's different.
Okay, I'm following you. Can you give me an example?
Sure. So let's say those same 3 hospitals each have a field for patient allergies, right?
Okay.
But they record that information in very different ways. One might list specific allergens, another might use broad categories, and yet another might just have a free text field.
Oh, I can see how that would be a nightmare to try to analyze.
It would be a nightmare. Harmonization is about figuring out how to map those different formats onto a common meaning. It can be quite complex, but it's essential for making sure the data is truly usable.
So normalization is about making the data look the same, and harmonization is about making sure it means the same thing, even if it looks different.
You got it. And this kind of work, normalization, harmonization, making sure data is clean and consistent, it's often called thankless data work.
Thankless? Why is that? It sounds incredibly important.
It is incredibly important, but it's often the kind of work that goes unnoticed until something goes wrong. It's not always glamorous, but it's the foundation upon which everything else is built.
It's like the plumbing in a house. You don't really think about it until there's a leak.
Exactly. And that's why it's so important to recognize the crucial role that data professionals play in making sure that our healthcare systems can function effectively.
Well, big shout out to all those data heroes working behind the scenes.
Absolutely. They're the unsung heroes of the data-driven world.
We've talked a lot about the importance of data standards in healthcare.
Right.
and how they're kind of like this common language for all these different systems to be able to talk to each other. And then we talked about all that data needing to be cleaned up and organized,
Yeah.
like using normalization and harmonization.
Yeah, it's a ton of work to make sure the data is accurate and consistent, but it's super important, especially, when you're dealing with something as important as healthcare information.
Absolutely, yeah. I mean, it's clear that there's a lot of effort that goes into making sure that this data can be trusted and used effectively.
Yeah.
So where do we go from here? What are some of the challenges and opportunities out there when it comes to data standards in healthcare?
That's a great question. I think one of the most exciting areas that's developing right now is the use of artificial intelligence, or AI, in healthcare.
AI in healthcare.
Yeah.
That sounds like something straight out of a sci-fi movie.
It does sound futuristic, but it's happening right now. AI is being used to analyze medical images, predict patient outcomes, and even personalize treatment plans.
Wow. That's incredible, but how do data standards fit into all this?
Well, for AI to work properly, it needs access to tons and tons of data.
Right.
And that data needs to be accurate, consistent, and well organized. That's where data standards come in. They provide that framework for ensuring data quality and interoperability, which is essential for training and deploying AI algorithms in a healthcare setting.
So data standards are like the foundation upon which AI in healthcare is built.
Exactly. Without those strong data standards, we wouldn't be able to do this. AI in healthcare just wouldn't be possible.
That's amazing. It really does sound like data standards are playing a key role in shaping the future of healthcare, not just in terms of improving data sharing, but also in enabling these cutting-edge technologies.
Absolutely. And as AI and other data-driven technologies continue to evolve, the role of data standards is only going to become more and more important.
Well, this has been a fascinating deep dive into the world of data standards and their impact on healthcare. I feel like I've gained a whole new understanding of how important this is, not just for today, but for the future of healthcare.
Well, I'm glad to hear that. It's been a pleasure sharing these insights with you. I hope you found it as interesting as I have.
I definitely have. And a big thank you to our expert for guiding us through this really complex topic. And to our listeners, thanks for joining us on this journey. We'll be back soon with another deep dive into a fascinating topic.
Until then, stay curious.